Good morning, Mr. Taylor. I'm Dr. Adams. Please take a seat. What brings you in today?
Doctor, I've been dealing with this really uncomfortable pain in my lower back for the last few weeks. At first, it wasn't too bad. It started off as a mild ache, something I thought would go away on its own. But, as time went on, it's gotten worse. Now it's reached a point where it's becoming really difficult to ignore.
I see. How would you describe the pain? Is it
It's mostly a dull ache most of the time, but occasionally it feels like a sharp twinge. I notice it especially when I bend over or try to lift something. Those movements seem to trigger it, and that sharp pain can be quite uncomfortable.
And when did this pain start? Do you recall any specific incident or injury?
Not really. It started maybe 3 weeks ago. I don't recall any specific incident where I might have hurt myself. But I do sit at a desk all day for work, so I'm wondering if that might have something to do with it.
That's possible. Do you experience this pain all the time, or does it come and go?
Oh, it's not constant, it comes and goes. I've noticed that it's particularly bad in the mornings, especially when I first get out of bed. At that time, the pain feels quite stiff and uncomfortable, making it hard to move easily. But, after I start moving around and getting on with my day, it seems to loosen up and ease a bit. It's like my body needs time to adjust or warm up before the discomfort lessens.
Right. Do you find that any particular activities make it worse?
Yeah, like I mentioned earlier, bending over or lifting anything heavy definitely makes the pain worse. Even small tasks, like picking up a bag or reaching for something low, can trigger it. Sitting for long periods doesn't help either. It seems to make the discomfort build up over time. I try to adjust my position or stretch a bit, but the relief is only temporary, and the ache tends to come back quickly.
Got it. Have you tried anything to relieve the pain?
Yeah, I've been trying to manage the pain with a heating pad. I use it in the evenings or when the pain feels particularly bad, and it does help to some extent. It gives me a bit of relief and makes the area feel less tense. Sometimes I'll also take ibuprofen when the pain gets too uncomfortable. It helps to take the edge off, but the effect doesn't last very long. The pain usually comes back after a while, so it's been more of a temporary fix than a solution.
Okay, let's talk about your medical history. Do you have any previous issues with your back or any chronic conditions?
Not really. There was this one time about a year ago when I had a minor muscle strain in my back. It wasn't anything serious, and it cleared up pretty quickly with some rest and taking it easy for a few days. Since then, I haven't had any issues, at least not until this pain started a few weeks ago.
All right, and do you exercise regularly?
Not as much as I should, honestly. I used to be quite regular about it. I would go to the gym a few times a week and stay active. But with work being so hectic lately, I've just fallen out of the routine. It's been hard to find the time or motivation to keep up with it, and I know that probably isn't helping things.
Understood. What about your posture? Do you notice if you slouch or sit awkwardly at your desk?
Oh yeah, I'm definitely guilty of slouching. I've noticed that my posture isn't the best, especially when I'm working. My setup at home isn't great. I don't have an ergonomic chair or desk, so I often end up hunched over my laptop for hours. I'm sure that's contributing to the problem.
Thanks for sharing all that. For now, I recommend that you continue using the heating pad to help manage the discomfort and take ibuprofen as needed, but be mindful not to overuse it. In addition to that, I'll refer you to a physiotherapist. They'll be able to assess your posture in detail and work with you to develop a tailored exercise plan. The goal will be to strengthen your back muscles, improve flexibility, and address any issues with your posture or workstation ergonomics to prevent further strain.
Good afternoon, Mrs. Carter. I'm Megan, your physiotherapist. What brings you in today?
Oh, good afternoon. Well, I've been dealing with this nagging pain in my right shoulder for quite some time now. It's been a couple of months, I'd say. It's not something that just appeared out of nowhere. It's been lingering for a while and hasn't really gone away. I thought it might improve on its own, but it's still there and it's starting to interfere with my daily activities.
I see. Could you describe the pain for me? Is it constant or does it come and go?
It's not constant. It doesn't bother me all the time. It comes and goes. But when the pain does show up, it can be quite sharp and noticeable. I've realized that certain movements seem to trigger it, like when I reach overhead to grab something or try to lift an object. Those actions make it feel much worse, and it's quite uncomfortable.
That makes sense. Do you notice if the pain is worse at a particular time of day?
Yeah, actually, it tends to get worse in the evening. By the end of the day, after I've been moving around or using my arm a lot, it feels almost like it's throbbing. It's not just the sharp pain anymore, it's this deep pulsing ache that makes it hard to relax.
Got it. And do you remember when this started? Did anything trigger it?
Let me think. Oh, yes, now that I recall, it started right after I helped my daughter move into her new apartment. I was lifting heavy boxes for most of the day furniture too. It was a lot of bending and carrying, and I think I may have overdone it. The pain started not long after that, and it just hasn't gone away.
Thanks for sharing. Have you tried anything to relieve the pain?
Yes, I've been using ice packs to try and manage the pain. I usually apply them a few times a day, especially when the pain feels more intense. I've also tried some anti-inflammatory gel that I massage onto the shoulder. They both help a bit and provide some temporary relief, but the relief doesn't last very long. After a while, the discomfort comes back and I find myself needing to use them again.
All right. Do you have any other symptoms like numbness, tingling, or weakness?
No, not really. I haven't noticed any other symptoms, just the pain itself. But sometimes I do feel some stiffness in the mornings. It's not too severe, but it takes a little time to loosen up and feel normal again.
Okay. Let's talk about your medical history. Have you had any previous issues with your shoulder or any other injuries?
Not with my shoulder, no. I haven't had any injuries or issues with it before. But I do remember spraining my wrist about 5 years ago. That's the only injury I've had that comes to mind. Other than that, nothing significant.
And what about your daily routine? Do you spend long hours in a particular posture?
Well, I'm a teacher, so my job involves spending a lot of time sitting at a desk, especially when I'm marking papers or preparing lesson plans. It's a lot of repetitive activity with my arms and shoulders, and I wonder if that might be contributing to the problem.
Got it. For now, I'd recommend incorporating some targeted exercises into your routine to help improve your shoulder mobility and strengthen the muscles around it. These exercises will be gentle but effective in addressing the discomfort. I'll also take some time to demonstrate proper stretching techniques that you can do daily to reduce stiffness and enhance flexibility. Consistency will be key here, so try to make it a regular part of your day.
Oh, that sounds great.
And make sure to avoid lifting anything heavy for the next few weeks to give your shoulder time to heal and prevent further strain. It's important to let the area rest while you work on the exercises and stretches. We'll review your progress in about 2 weeks to see how things are improving and adjust the plan if needed.
Okay, thank you so much.
Dr. Patel, I wanted to update you about the patient in bed 3. She's been experiencing a persistent cough and has developed a mild fever. Based on your earlier instructions, I've already started her on the prescribed antibiotics to manage the antigen.
Good. That's a solid start. Make sure to keep a close watch on her temperature. If it rises above 38 degrees, notify me immediately so we can reassess her condition and make any necessary adjustments to her treatment plan.
Understood, doctor. I'll ensure her temperature is closely monitored. Also, should we continue with the hourly checks for her oxygen saturation levels? We've been tracking them carefully since her symptoms began to worsen.
Yes, definitely. Hourly checks for her oxygen saturation are crucial, especially given her respiratory symptoms. We need to ensure her oxygen levels remain stable. If there's any significant drop or other concerning changes, let me know immediately. This close monitoring will be key until we see clear signs of improvement in her symptoms
Dr. Lee, I've just reviewed the X-ray for Mr. Simmons, and it appears there's a possible fracture in the left tibia. The images suggest a clear disruption in the bone structure, but I think a CT scan might be necessary to confirm the diagnosis and get a more detailed view. Should I go ahead and schedule?
Not just yet. Before proceeding with a CT scan, our immediate priority is to stabilize the leg to prevent any further injury. Let's immobilize it for now and arrange for a thorough orthopedic assessment. We'll decide on additional imaging after evaluating him clinically.
Understood, doctor. In that case, should I inform the ward staff to prepare a splint for immobilization? That way, we can ensure the leg is supported properly and minimize movement while we wait for the assessment.
Yes, absolutely. Please notify the ward staff to prepare a suitable splint for his leg. Also, make sure Mr. Simmons is instructed to remain strictly non-weight-bearing on that leg until we have a clear plan in place. It's important to avoid any unnecessary strain on the affected area during this time.
Team, just a quick update. The fire drill is scheduled for 3 p.m. today. It's crucial that all staff ensure patients are either in their rooms or designated common areas during the drill. Additionally, please double check that the evacuation protocol is prepared and accessible for everyone.
Understood. Thank you. Should we inform the patients about the drill beforehand, or would it be better to keep it unannounced?
Yes, we should inform them, but it's important to keep the explanation brief and simple to avoid causing any unnecessary alarm. Let them know it's just a routine safety exercise and nothing to be worried about. This way we can maintain calm while ensuring everyone is prepared.
Have you had a chance to update Mr. Taylor's medication chart yet? I want to ensure everything is in place for his treatment plan, especially with the new adjustments we discussed.
Yes, doctor, I've added the diuretic you prescribed to his chart as per your instructions. However, when I spoke with him this morning, he mentioned feeling quite dizzy, particularly when he stood up. I made a note of it, but I thought it would be important to let you know.
That's definitely concerning. The dizziness could be a side effect of the diuretic, or it might be related to his blood pressure, especially with the medication change. Let's be proactive and monitor his blood pressure more frequently today. I'll have the nursing team check it every couple of hours. If there's a significant drop, we may need to adjust his medication or hydration levels accordingly. Let's also keep an eye on his overall fluid balance.
Absolutely, doctor. I'll make sure the nursing staff is aware of the increased monitoring for blood pressure, and I'll keep an eye on any additional medications that could be contributing to his dizziness. I'll also inform them about the need for regular fluid balance checks to ensure we're managing his electrolytes properly.
If the dizziness persists or worsens, we may need to reassess the diuretic dosage or explore alternative treatments. Keep me updated on any changes, and let's discuss Mr. Taylor's progress during rounds.
Dr. Williams, just a quick update on Mrs. Olson. Her contractions are now 5 minutes apart. Should we start preparing the delivery room and get everything ready for the next stage of labor?
Not just yet. 5 minutes apart is a good sign that things are progressing, but let's hold off on preparing the delivery room until her contractions become more frequent around 2 to 3 minutes apart. We want to ensure that she's in active labor before we make the final preparations. Keep monitoring her closely to track the pattern of contractions and her overall progress.
All right. I'll stay with her and continue monitoring her contractions. I'll check in regularly to update you if there's any change in frequency or intensity, and I'll be ready to move forward when we're closer to the active phase of labor.
Great, keep me posted. Make sure to also observe any changes in her vital signs or if she begins to show signs of distress. We'll need to move quickly once the contractions are closer together, so let me know as soon as we reach that point.
Team, I have an important update. The new blood glucose monitors we've been waiting for have finally arrived. These devices are more advanced and come with features that should improve accuracy and efficiency in patient care. However, it's critical that all staff members are properly trained on their use to ensure we're utilizing them effectively and safely. Please make it a priority to complete the training sessions by the end of the week.
Thank you for letting us know. Should we start using the new monitors immediately, or would you prefer that we hold off for now?
That's a good question. For now, let's continue using the old monitors until the training is fully completed. It's essential that everyone is confident and comfortable with the new devices before we transition. This will help us avoid errors and ensure a smooth implementation. In the meantime, I'll coordinate with the training team to schedule sessions at times that are convenient for all shifts.
Understood. I'll communicate this to the rest of the staff and encourage them to sign up for the training as soon as possible. Is there a specific protocol we should follow during the transition, such as running parallel checks between the old and new monitors once training is done?
That's a great idea. Once the training is complete and we're ready to switch, we can run a short parallel testing phase to compare results and ensure everyone is confident in using the new devices. Thank you for suggesting that, and let me know if you or your colleagues have any additional questions or concerns during this process. Good morning, everyone. Today we'll be discussing hypertension, one of the most common yet preventable causes of cardiovascular diseases worldwide. Hypertension, also known as high blood pressure, occurs when the force of the blood against the walls of the arteries is consistently too high. The primary cause of hypertension is multifactorial, with lifestyle factors playing a significant role. Lack of physical activity, unhealthy diets high in sodium, and excessive alcohol consumption are key contributors. However, genetic predisposition also increases the risk, especially in individuals with a family history of hypertension. Early symptoms of hypertension are often subtle, which is why it's called the silent killer. Many individuals remain asymptomatic until significant damage occurs. However, some people may experience early signs such as mild headaches, dizziness, or occasional nosebleeds. Certain demographics are more vulnerable to developing hypertension: adults over the age of 40, individuals with a sedentary lifestyle, and those with conditions such as obesity or diabetes are at particularly high risk. Interestingly, studies also show that stress and smoking significantly contribute to elevated blood pressure. When it comes to managing hypertension, lifestyle modifications are the first line of defense. Regular exercise, a diet rich in fruits, vegetables, and low-sodium foods, and weight management can make a huge difference. If lifestyle changes are insufficient, medications such as diuretics, ACE inhibitors, or beta blockers are commonly prescribed. These medications help by relaxing blood vessels, reducing fluid retention, or slowing the heart rate, thus lowering blood pressure. Effective treatment not only controls blood pressure but also prevents complications such as heart attacks, strokes, and kidney damage. However, long-term management is essential. Patients must adhere to their prescribed regimen and attend regular follow-ups with their healthcare provider. Finally, let's discuss prognosis. With timely intervention, many patients achieve controlled blood pressure and lead healthy lives. However, if left untreated, hypertension can lead to irreversible organ damage, and the condition often becomes chronic. This underscores the importance of early detection and ongoing management.
Good afternoon, everyone. Today we'll discuss diabetes, a chronic condition that has become a significant global health concern. Diabetes is characterized by elevated blood glucose levels, which occur when the body either doesn't produce enough insulin or cannot effectively use the insulin it produces. There are three primary types of diabetes: type 1, type 2, and gestational diabetes. Type 1 diabetes is an autoimmune condition where the immune system attacks the insulin-producing cells in the pancreas. It often develops in childhood or adolescence. Type 2 diabetes, the most common form, is largely associated with lifestyle factors like poor diet, physical inactivity, and obesity. Gestational diabetes occurs during pregnancy and usually resolves after childbirth, but it increases the risk of developing type 2 diabetes later in life. Let's move on to risk factors. For type 1 diabetes, genetic predisposition plays a crucial role, though environmental triggers like viral infections may also contribute. In contrast, type 2 diabetes risk factors include being overweight, having a sedentary lifestyle, and a family history of diabetes. Additionally, certain ethnic groups such as South Asians, African Americans, and Hispanics are more predisposed to this condition. Early symptoms of diabetes can vary but often include increased thirst, frequent urination, and unexplained weight loss. Fatigue and blurred vision are also common indicators. Unfortunately, many cases of type 2 diabetes go undiagnosed for years due to mild or nonspecific symptoms. Now, onto management strategies. The cornerstone of diabetes management is lifestyle modification. A balanced diet focusing on whole grains, lean proteins, and vegetables, along with regular physical activity, is vital. Monitoring blood sugar levels regularly is also essential. For type 1 diabetes, insulin therapy is the primary treatment, while type 2 diabetes can often be managed with oral medications such as metformin or injectable drugs like GLP-1 receptor agonists. Complications can arise if diabetes is poorly managed. These include heart disease, kidney damage, and nerve damage, which can lead to serious issues like amputations. However, with proper management and regular medical follow-ups, many individuals with diabetes can lead healthy, active lives.